So if you're only missing one tooth, why a dental implant over a traditional proven bridge?
Well, a smart dentist once told me, one of my early professors said, why turn a one-tooth problem into a three-tooth problem? And what I mean by that is you got to touch and mess with the teeth next to the space of the tooth that's missing in order to do that bridge. Well, what does that do? Well, it lowers the lifetime predictability of this bridge, meaning 8, 12 years, you're probably going to need to replace it. Whereas an implant, you just put a new tooth, very similar to the old tooth that you had, right in that spot and can leave those other neighbors alone. So long term, it's a much more cost-efficient option, much more predictable. You're much less likely to have any problems.
If somebody in your family was of the age they can do this, and they were just missing one tooth, would you always do an implant over a bridge?
I would always do an implant over a bridge, absolutely.
So what are they afraid of? They're just afraid, like it sounds like surgery, so they're going, man, I don't want to do it.
Yeah, it's like they're thinking hip implants or like shoulder replacement. They're thinking these big hospital surgeries. The reality is for these single ones, they're in and out of the chair in a half hour, and I expect very, very little post-operative discomfort. They tell me there's very little pain with these.
So they're numbed up.
They're numbed up.
Sedation's even available if you're really
if they really need it, sedation's available. We use what's called guided surgery. I make the guides in my office. That allows me to place these implants with such precision that it's within the millimeter of where I've planned it. They're in the perfect spot, and it makes the surgery less traumatic. It makes it much quicker.